All right, well, it's 12:02, so I think we will get started. Hi there, everyone. This is Jenny Hetkowski from Starbridge. I am 1/3 of the New York State Transition Partners. We do this work along with Parent Network of Western New York and include NYC in New York City. And we're a collaboration that works together for the RSA to provide information and strategies to help young adults with disabilities and their families access and navigate systems. So I'm going to keep my comments pretty short this morning because Andy has a lot of good information for you. I do want to let you know that if there are questions that are pertinent to something Andy's talking about that we think need clarification, I will jump in and ask the question. You can put your questions right in the chat box, and I will be monitoring that. At the end, Andy will answer any questions that we can get to, and then we will also take all the questions that are in chat and give them to Andy, and he will share responses to them in an email at a later time. So your questions will get answered. They just might not be on this call. We will do our best to get to as many as we can, but he does have a lot of information. The last thing before I introduce him is to please do the survey at the end. Surveying you is information that we give to our funders, and that helps us do this work and keep it free. And without further ado, Andy Sink is here, and he is the acting director of NYESS, which is the New York Employment Services System, and he works in employment policy and research for mental hygiene, and he's been involved in employment and rehabilitation services supporting New Yorkers facing various barriers since the early 2000s. Andy and his team promote principles and policy to improve employment outcomes for all individuals with disabilities in New York throughout collaborations with state agencies, service providers, and advocacy organizations. So without further ado, here's Andy Sink.
Thanks so much, Jenny, and thank you so much for the invitation to be able to speak with you folks today. Like Jenny said, I do have a lot of content. I did overload the content intentionally, knowing that we did just have an hour, that when you go away with the PowerPoint, hopefully there's some helpful links in there for you, depending on what it is that you're really interested in. So go ahead, next slide, please. So what we're going to talk about today, I'm going to briefly go over what the New York Employment Services System is and how it fits into our services system. I'm going to talk about the Employment First initiative and what that is, what the principles of that are. And I'm going to cover some of the activities that New York has engaged in regarding the specific Employment First goals and the recommendations of the Employment First Commission. And that's going to include the Transportation Network Company Accessibility Task Force, the Work Incentives Navigator, and I've also included some general information about New York employment, what services are available in New York through Office of People with Developmental Disabilities, the State Office of Mental Health, the Department of Labor, and the Adult Continuing and Career Education Services, commonly known as VR, as vocational rehabilitation. Next slide, please. Okay, so nice. This is just a list of our state partners. The New York Employment Services System was built, it's an online employment services case management system, okay? So it was built using Medicaid infrastructure grant funds, and the whole point of the MIG, the Medicaid infrastructure grant, was to improve collaboration between state agency partners, between state agencies and their provider partners, and communication between providers in the community with each other as well. And the whole goal of which was to improve employment services for individuals that we serve. The fact is that many of the individuals that are served through New York's various funded employment services will work with different funding streams and different service providers, maybe within a given area. So, you know, in Buffalo, there are lots of really great employment service providers. And if that individual, say, moved down the road to Rochester, there are other employment service providers. And so we have provider affiliates around the state that use the system. And there are three major goals of the New York Employment Services System. And this is the online portion of it itself. The first is that it's a collaborative case management system. So if I do have an individual, if I'm working with Jenny and then I go into the system, I can also see that she's worked with 3 other agencies, and I can see what type of activities that she engaged in, and I also have a record of her employment services history and her actual employment history, and that's really helpful because often when an individual goes from one service provider to another, not all of the historical information will travel with them. So this case management record for them that lives in the NYESS system will travel with them and allow a streamlining of starting new services and give providers a better idea of what an individual is engaged in. And it's also very practical to have all of your employment history in one place that you can access. So if you're creating a resume or filling out job applications, that all that stuff is right there. The 2 other main components of the NYESS system are data fidelity. So the state can use the data collected from NYESS to answer questions about what type of services and activities individuals are engaging in and what type of outcomes are we seeing. The subsequent part of it is that it's also part of an administrative employment network through the Ticket to Work program administered by the Social Security Administration. So I'm not going to talk too much about that today because we could, that would take up a lot of time. But if that is any of those things, if you don't get enough information about it today, feel free to follow up with me after. I believe my contact information is at the end of the PowerPoint. So NYESS is the system itself, but it also is our team. And what we do is we support any of the state agencies and their provider affiliates in everything related to employment and disability and benefits and linking to various resources. And so we have the luxury of being able to work cross systems, and that's sort of one of the reasons why we exist. So, okay, next slide. Okay, very simply put, employment first is the principle that for individuals being served by our support system, that employment should be the first option for activities that they engage in. Historically, our services system doesn't necessarily do a very good job of linking individuals to employment and making employment a priority. And we know that employment is an indicator of quality of life, improved not only economic health, but physical and mental health. So we know it's a good idea, but we just don't do it very well as a services system. We certainly do in pockets, but the whole point of employment first is to have that be, that's the first question we're asking. One of the things our services system is trying to learn how to do better is if we are linking people to employment services, how are they learning a work ethic? You're not born with a work ethic. It's something that you need to learn. And how do you do that? It's through work-based learning experiences. It's through trial and error. It's using the supports that are available to you. So any of you who have worked throughout your lives, I'm sure can think about those first jobs that you had that maybe you weren't all that successful at. But that's all part of the learning process. And we need to be able to work that into our services system and help the people that we're serving and our service provider system understand that a work environment is going to be different than a school environment, is going to be different than a supportive day program environment. And what does that mean for the individuals we're serving and their goals? So government Cuomo established the Employment First Commission using Executive Order 136. What that is basically it's a commission of major state partners to talk about how do we want to address these various things. The 3 largest goals are to increase the employment rate of individuals with disabilities by 5%, which is a lofty goal, as that probably hasn't changed in around 30 years. And so that's what we're working towards. Decreasing the poverty rate of individuals by 5%. We know that many of the folks that are being served on our system rely almost solely on SSI or SSD, which is, which can mean differing rates of poverty. And another part of this is helping businesses in New York and helping service providers in New York engage with each other to adopt policies and practices that support these principles that are related to inclusion and diversity. Next slide. Okay, so what I'm going to go through briefly here is there are a series of recommendations that were put together by the Employment First Commission. And I do have some links in here where you can get into more details about what that means. So I'm going to go through the recommendations themselves. I may get to some of the stuff that we've done to work towards that recommendation, but then I'm going to talk about some sort of activities that I want to highlight. So cultural modeling, it's simply put, it is a workforce should reflect the diversity of its environment. Diversity and inclusion can mean different things. It can be made up of different things depending on where you are. So if you're in Buffalo, or you're in Niagara Falls, or you're in Syracuse, or here in Albany, that's gonna be a different makeup of the individuals that make up those that live in those communities. And the idea of cultural modeling is, if you have an inclusive workforce, it'll be a reasonable representation of a cross-section of that community. Energizing the demand side of the equation is really talking about, okay, how do we engage with businesses to help them understand, if they don't already, that hiring qualified individuals with good ideas is good for business. For the most part, we can help them how to do that. We can help them find supports for their business to be inclusive. But at the end of the day, they want somebody that can do the job. They don't care whether an individual, what barriers they might have or what classification they might fall under. The bottom line for them is, I run a business, I need somebody to do something, and with or without supports. And so helping them understand how to work with the service provider community and to be more inclusive is good for their own business. I talked about the NYESS system. The part of the recommendation of the commission was to continue to use the NYESS system to answer questions about the data in New York State, who's being served, and tracking some of the outcomes we're looking for, including employment, including wages. So as part of the NYESS system, we use varying sets of data to answer different questions. And I'm going to talk a little bit more about that when we get to the Work Incentives Navigator. All right, next slide. Okay. This is key for anybody who is going to be, for an individual who is considering going to work on public benefits, be it supplemental security income, Social Security disability, or public assistance through DSS, or maybe simply SNAP or Medicaid. Benefits advisement is complicated. Understanding what happens to your public benefits when you're earning is complicated, but that doesn't mean that our service providers shouldn't have the resources to be able to talk about the basics, talk about really key benefits. And also that information, there should be information available to the individuals and the families that we're serving about, okay, give me a baseline understanding of what happens to my SSI if I start earning. What does that mean? And it's important for our services system to be able to say, I don't know. I don't know is a really great answer because there's a lot of misinformation about what happens to benefits out there. So one of the recommendations is to ensure that there is benefits advisement information available. I'm going to talk about the Medicaid buy-in for working people with disabilities more in a little bit, but it's basically a free Medicaid program for individuals who qualify, and they can earn over $60,000 a year in wages and still be eligible for Medicaid. Transportation, establishing a cross-agency task force. That's the Transport Network Transportation Network Company Accessibility Task Force that I'm going to talk about. It's a really clumsy name to say. Transportation network companies are referring specifically to companies like Uber and Lyft, and I'll talk more about that in a minute. Next slide, please. Okay, these are all pretty straightforward, so make sure that we're improving pathways for youth transitioning to adulthood. Some of my partners on the phone are familiar with a project that has going into the end of its 6th year. It's called Promise. It's promoting the readiness of minors and supplemental security income. Short story is that it is testing interventions to help students and families who are receiving supplemental security income improve outcomes in the areas of education, economics, and employment. So that and the Promise Steering Committee, which is made up of our statewide partners, has been established as the subcommittee on transition for the Employment First Commission. So right now, there's a lot of stuff, as you know, this is part of it. There's a lot of resources being put forth in how do we do better at transition, and Promise is one of those examples. You know, today's conversation is one of those examples as well. I talked a little bit about our services system, so create an employment first service culture. That's really talking about what are our practitioners, how are they practice? So top down in a service provider agency, what is the board or executive team or management team, how are they communicating to their frontline managers? Is employment a priority? And how are those managers working with their staff to make sure that the services they're providing reflect an employment first service culture? And that can be difficult if, you know, that's the idea of employment being a good idea is not always shared across our services culture. And so that's something that we're constantly pushing against and educating and helping people understand that it's a good idea and should be worked into all of our programs. Self-employment and entrepreneurship, that's pretty straightforward, and make sure we expand upon existing resources to improve supports for small businesses operated by individuals with disabilities. Okay, next slide. Expanded access to assistive technology, that's pretty straightforward. Using Ticket to Work revenue, we were able to purchase some assistive technology for our various Department of Labor Career Centers around the state, and that's an initiative that's still going on. Outcome measures use existing data sources to measure progress, of course. I put some links in here. We're not going to talk about all of them, but they pertain directly to Employment First in the various iterations of the communications that came out around it. Next slide. Okay. I'm not going to spend too much time on these. Our partners at the Office for People with Developmental Disabilities took the lead in developing a toolkit for employers. Think of it as a marketing document to show employers evidence-based information on why it's a good idea to hire qualified individuals with disabilities. There's been a lot of great research about how it's good for your bottom line, it's good for retention of employees, and what type of employers these individuals are, or employees, excuse me. The guide for employment specialists, that was actually our friends in the Office of Mental Health who took the lead on that, and that is really an employment guide for employment specialists to know where to go for certain resources. What are the key things we want to be focusing on when delivering employment services? I think one of the biggest takeaways should be that it doesn't matter what the specific disability is that you're assisting someone to achieve their goals under. It doesn't matter what the funding stream is. There are going to be rules attached to it. There's going to be reporting requirements attached to it, but we should be functioning with a specific set of principles, all of which are relating to assisting a person to become as independent as possible with supports that are needed, and to become as financially independent as possible. I included the NYESS resource page. There's a lot of information on the NYESS resource page pertaining to any public benefits and how income may affect them. Savings programs for individuals. Information about 55A, 55B, and 55C, which are state, county, and veteran hiring initiatives. So I'm not going to go over all that today, but I wanted to make sure that you knew it was there, and that was done using Underemployment First. So next slide. Okay. Like I said, a transportation network company in most cases is Uber and Lyft. There is a recognition that transportation is a barrier, can be a barrier to individuals facing all types of disabilities across the state, and it can vary widely depending on whether you're in a rural region or an urban region or a suburban region, what types of transportation are available. But there is a recognition that on-demand transportation could be incredibly beneficial for the folks that we work with to improve the flexibility that they have in getting places in their lives. So go ahead, next slide. And what I didn't do, and Jenny, remind me at the end when we stop for questions, I did not include the link here, but I will email it to you or put it out right in the chat box so folks can look at the actual TNC report. So the task force was established in 2017. Their task was to explore transportation challenges for individuals with disabilities in New York and make recommendations for improvement. And again, with a focus on services like Uber and Lyft. Inevitably, during the process, we're also talking about existing transportation options, paratransit, public transportation, taxi cabs, etc. But one of the things that makes transportation network companies different is that their model allows for an incredible amount of flexibility, but there's only so much regulation that they can do as transportation network companies because all of their drivers are contracted employees. So there's only so much they can regulate. There were 5 forums held across the state. It was a stakeholder gathering information sessions. There were about 150 people that attended those, and we had a task force mailbox in which we had 60 respondents email in both concerns and recommendations. Next slide. And so what I'm showing today is not the full report because it is quite lengthy and quite detailed. But this is the consolidated concern category table from the individuals who have participated in the forums or sent in written concerns. Initially, the major concerns were around wheelchair accessibility, the use of service animals, and what was required of transportation network companies to provide accommodations. You can see also that the feeling that paratransit can be incredibly unreliable depending on what area you live in, resulting in having to schedule day or days in advance, long wait times, etc. There's also a lot of concern about safety for the individuals that that might be served by our services system, and that included cross disabilities based on whether an individual was blind or visually impaired, had wheelchair accessibility issues, perhaps an individual who, for whatever reason, had barriers to communication or assertiveness in communication and fears that they might be taken advantage of. And there is, in the paper itself, there are, basically what I did was just made major buckets of these different things, but there are more specifics related to these categories in the paper. And again, I'll share that link in case it's something you're interested in. Okay, Jenny, next slide. So we did the same thing with proposed solutions. There are recommendations that the commission made as well that are in the paper. What I really wanted to share, though, was what we found during our information gathering exercises. The vast majority, the largest is, of course, just improving the availability of accessible vehicles. That, of course, ranges greatly across the state. TNCs have committed and put on the road accessible vehicles. One of the things that was brought up a lot also is to expand the transportation network company model to access more rural areas, to incorporate these various accessibility barriers, both for individuals with and without disabilities, into their model. And Uber and Lyft were on this task force, and they were both companies were very responsive. There's an area that is incentivize accessible vehicles and also ride surcharges. Those two things are related. So one of the things that came up a lot was incentivizing accessible vehicles by either allowing for tax credits for individuals who, rather than having just a regular vehicle that may not have any accessibility options on it, say a ramp, but provide tax incentives for those that did, or potentially fund the modification of existing vehicles using a percentage off the top of any rides that happen to help fund the adaptation of existing vehicles, which can be very expensive. So again, there are more specifics about that in the Transportation Network Company paper. Looks like we're about halfway through. I hope I'm not going too fast. I do want to cover as much as I can, though. Jenny, any questions coming in that need to be addressed now?
Not yet, so we're good to go.
Great. Okay. Next slide, please. Okay. So this is what our providers see when they log into the NYESS system. There are various things available to them. The one I want to talk about today is the Work Incentives Navigator. I'm just looking at my notes quickly here. So the purpose. So you remember one of the recommendations of the commission was to improve benefits advisement in the state and information related to benefits advisement. Overall, the purpose of the Work Incentives Navigator is to provide preemptive benefits advisement to our customers using our NYESS data, so we know who our customers are. We use Medicaid data to know what their status is with SSI and Medicaid, so we can make some assumptions about where they are as far as how wages might be affecting their benefits. And specific wage data, so we know we can say to someone, hey, we can tell that you're getting close to potentially no longer be receiving an SSI cash benefit. These are things that might be able to help you, like how to keep your Medicaid, how to keep your relationship with the Social Security Administration, et cetera. So what I'm going to do now is I'm going to go through some of those specific benefits. That they're a snapshot of what might be available, but I think that they're really important ones, especially when we're starting to talk to youth and families while they're in transition about what are the important benefits that I might need to be aware of. Next slide. Okay. So let's look across the top first. So there are various tabs there. One is the Home tab, and you see that I'm sure some of this is very small for you to see right now, but you're going to receive the PowerPoint. it describes the purpose of what is the Work Incentives Navigator. And if I go to the right, I would see customers that are linked to me as a provider. And customers meaning individuals who are receiving services. I know it's really tough to keep track of some of the jargon that we use, so I hope I'm being as clear as possible. The next tab would be benefits, and it would sort the individuals based on benefit type. So basically, this is a reports portal where a service provider can track who received the notification about a benefit, and if they did receive a notification, what was it? What is the pertinent information? And were we maybe trying to contact those individuals about a specific benefit, or maybe they had email issues, and we have a way for them to be able to update the email address that would be in the system. So what we do is we use those various data sets to answer questions and to make recommendations. Those are, so an individual has earnings. We know they're on SSI. We're going to send them a notification via email, and we're going to log it in this tracking system where their providers can see about specific benefits. So now if you look down to the left, we've got the EITC. That's the Earned Income Tax Credit. So if you're in this Work Incentives Navigator and you hover over the EITC, you'd see an explanation of what that is. The Medicaid buy-in for working people with disabilities. Same thing, you'd see an explanation of what that is. Section 1619B and Section 301 of the Social Security Act. So the one that's showing right now is the Section 301 of the Social Security Act. So next, what I'm going to do is go through each one of those just to give a little bit of background on what they are and why they're important. We could do a lot longer than an hour just going over some key benefits, but these are the ones that we have built so far for the Work Incentives Navigator. Next slide. Okay. If you have the most common way an individual loses SSI, based on disability, not based on wages, is after the age 18 redetermination. If an individual is determined to not meet disability criteria for the Social Security Administration at an age 18 redetermination or whenever else, Section 1619B would allow them to keep their SSI cash payments and keep their Medicaid. Oh, you know what? I just got these screwed up. So I'm talking about Section 301. Can you just go to the next slide for me quick? I just want to make sure I didn't overlap these. Okay, so 1619B, I will talk about Section 301 in a minute. So Section 1619B is specifically for individuals who lose, they no longer receive SSI due to earnings, but can keep their Medicaid through Section 1619B. So Section 1619B should be activated automatically once the SSI cash payment is reduced to zero, but we find across the state that that's not always the case. So it's really important to work with an advocate or a certified benefits practitioner to make sure that it's activated. So short story, individual on SSI earns wages but no longer receives a cash benefit. Section 1619B allows them to keep their Medicaid. Now their resource limits would stay the same as if they were on SSI, so there are more specifics there, but that should be an automatic process. Next slide. So let's say an individual is receiving Medicaid because they still qualify under Section 1619B, but they want to have savings over the SSI limit, which would be $2,000. They could save significantly more by applying for the Medicaid buy-in for working people with disabilities and earn over $60,000 and still keep their Medicaid. An individual does not have to have been on SSI or SSD to apply for the Medicaid buy-in. And one of the reasons why, if you remember, one of the first recommendations of the commission, it was to improve the use of the Medicaid buy-in. And the fact is that it's free and it's very underutilized. Next slide, please. So we talked about Section 1619B, the other Medicaid program, being supposed to be automatic. For the MBI-WPD, I think someone is not muted. Heads up, I can hear some background noise. So can you check your lines to make sure you're muted? Thank you. So for the Medicaid buy-in, that is something you need to apply for. And the Medicaid buy-in toolkit, and this is hyperlinked, so if you do have this electronically, you'll be able to click on that and be able to find it on the web. If not, if you just did a brief search for the Medicaid buy-in toolkit, you'd be able to find it. And what it does is it walks you through step by step what you need to know to apply for and to know whether you qualify for the Medicaid buy-in. Okay, next slide. Thank you. Okay, so this is Section 301, and I apologize for all the jargon. It is confusing. I was talking about the age 18 redetermination, or if an individual is no longer eligible for SSI based on disability, they would be able to continue their cash benefit, even if they're no longer considered disabled, if they're engaged in a qualifying program. And that would be Ticket to Work, vocational rehabilitation, or another type of rehabilitation with an employment plan, or if they're still in school and have an individualized education plan. Short story is that if you show SSI, there is an application process for this, you show the Social Security Administration that you are engaging in something that will help reduce your long-term reliance on public benefits, they'll allow you to continue to receive cash benefits. I want to be clear that I'm not encouraging folks who no longer meet disability criteria to rely on the cash benefit, to rely on public benefits, but we know that it's going from having earnings and having enough earnings to potentially be off of significant public benefits that can be a long-term process, and it's important to be able to support individuals as much as we can, which is why we highlight, how do you keep your medical insurance? How do you maybe keep your cash benefits while you're engaging in a program while you're working towards self-sufficiency? Okay, next slide. We include the earned income tax credit too, and this is regardless of disability. This is for eligible low-income workers with and without disabilities. And very often we find that, especially folks who are being served in our system, maybe they're not making enough where they think they have to do their taxes, but they may be missing out on a tax credit owed to them by the federal government. And the whole point of the earned income tax credit is to reduce tax burden on individuals who are low income and may be working towards a higher level of self-sufficiency. So around the beginning of tax season, we look through our data sets and we send notifications to folks to, hey, make sure you do your taxes, and when you're doing your taxes, make sure you explore whether or not you're eligible for the earned income tax credit. And if you don't know, here's a list of volunteer income tax associates where you can find somebody to help you answer that question. And here's our number if you have questions. And so we'll get calls and somebody will say, well, yeah, I didn't do my taxes. I didn't think I needed to. And then they find out that they're eligible. And they're actually able to do their taxes for free. Or we talk to folks who say, I did my taxes, but I wasn't aware of this. Is this something I can go back and talk to the government about? And the answer is yes. Next slide, please. So this is just some eligibility information. It's earned and adjusted gross income, and it's the different categories are whether or not you have a child and how many children do you have. So for an individual with no children, your gross income would be less than $15,000. And for a couple filing jointly with one child, your adjusted gross income would be $45,207. And what I tell folks when we're talking about eligibility criteria for all of these things is, make sure you're talking to a benefits advisor, a certified benefits practitioner, or a tax professional about this one specifically, and say, hey, I think I might be eligible for this, but I'm not sure. Or maybe I'm on the cusp and I'm not sure. Next slide, please. Oh, we can skip this one. This is just more eligibility criteria. Next slide. Thank you. So the credit is also related to whether or not you have children. So for no children, it's $510. But for an individual with 3 or more qualifying children, there's a potential for $6,300. So it could make a significant difference in a family's financial well-being. Next slide, please. Okay, I'm going to stop here. That we can talk about all of the rest of these employment services, but this is information that is easily accessible. So why don't I hold for a second and see if there are questions? I think this is perfect time. We've got about 15 minutes. And if not, then I can go a little bit into what's available in the state.
So there are no questions right now, unless Nancy tells me differently, but I'm not seeing any.
So
there aren't any.
Okay, great. So I just want to open up and say that I know I'm covering a lot of different things. So if you have questions about public benefits and working, if you have questions about the New York Employment Services System, about Employment First, about any of the Employment First activities I discussed, I'll just give it a minute and see if there are any.
I'm not seeing any yet.
Okay.
But if one of the ways to do this would be also for you to think of, what are the questions that you get most commonly, and maybe answer one of those. What are the
Sure.
Where do most people have misunderstandings?
A lot of it is about how do earnings affect my public benefits. I'm receiving income, and this is both families and the students. I'm receiving public benefits, and they're part of how we support ourselves as a family. Why is it a good idea? People starting the conversation. It can be a very anxious conversation because there's so much misinformation and misunderstanding about, if I go back to work, they're going to take my benefits, or if I go back to work, they're going to say that I am not disabled. And so I wouldn't be eligible for things that I'm eligible for now. Is it true that that wages will affect your public benefits? Yes, absolutely. But there are ways to plan for it. There are ways to prevent from falling off a cliff, say. And there are certain things that will minimize the effect that wages have on your public benefits. And at the end of the day, if you're on public benefits and you're earning wages, you will end up with more money in your pocket. There are certain things you need to keep in mind, like making sure to report wages to prevent an overpayment. Say SSA there's a lag in them getting wage data from employers, and so if I work for 6 months, and SSA, and I have not reported that, and then SSA sees that I have, that would be an overpayment situation. So that's something you always want to prevent. And then I think it's talking about, okay, there are employment services out there, what's right for me? And so we do that on a regional basis. We often get calls from parents or from individuals accessing the services system, and that's where we link them with Department of Labor, Access VR, Office of Mental Health, Office for People with Developmental Disabilities, or maybe their local independent living center to say, okay, so we know that there are options throughout the state, but that could look very different in Tonawanda than it does in Niagara Falls, or here in Schenectady or in Troy. So, what do we know about your local resources?
Okay, Andy, I'm not seeing questions, but Nancy is telling me there are, so I'm going to let her go ahead and sort through them and read one to you.
Okay.
All right, the first one is, who can speak with my adult son who's looking for employment and in need of reasonable accommodations? I am not understanding this need, and I need a contact to help him get a job.
Did you say she's not understanding the need, or?
I don't think she's understanding who she should be contacting.
Okay, yeah. So you can contact me directly if you want to talk about what services are available in your area. The most common place to start would be, especially for upfront intensive employment services, could be Access VR. And I would also contact your local Department of Labor one-stop career center, because most likely that can be a hub of what resources are available in your area and how to apply for them. There is if you just do a Google search, if you just put in Career Center Locator, I'm actually just putting it in now on my computer so I know that I'm not giving you the wrong information. Yeah, Career Center Locator, and all it asks for is your zip code, and contact your local Department of Labor office, because you can say, hey, this individual, my son, or he can call and say, I'd like to explore what services are available in my area. Who do I talk to about that? In many of those career center locations, there is what's called a Disability Resource Coordinator, or DRC, and that individual will know specifically, okay, for that, I would recommend talking to Access VR, or potentially a PROS program through the Office of Mental Health. The Personalized Recovery Oriented Services has a menu of things that would be able to help you reach that goal. So I would do that, and if you wanted to have more of a one-on-one conversation about what's available in your area, or talk about your son's, or if your son wants to call and talk more specifically about what type of reasonable accommodation is needed, we can hone in more specifically on what funded service might be most appropriate.
There's another question here. What exactly are the important benefits youth in transition need to be aware of?
Great question. I think overall, it's connecting dots to various types of supports that might be necessary. So, is the family linked with a parent network? Has the individual been engaging with their school to make sure that they're engaging in work-based learning experiences? And if it's not happening through the school, where else can we find that resource? I think that Section 301 is really important. As a bridge for individuals who may have an unfavorable assessment after the age 18 redetermination, and knowing that, hey, if I still have an IEP, if I'm engaging with Access VR or in another employment program, I may still qualify. I would also encourage, what's the priority? Is it school? Is it work? And who is it that's in my area is going to be my go-to person for that? And I think having a frank conversation about this is what your public benefits are. This is what this school is like, and after school it's going to be very different. These are the different types of environments that you will have options about choosing your own adventure. What is that going to look like? And being very frank about it, and going and looking at as many things as you can to really expose, so there's a concrete understanding of what is that school program like, or what is that apprenticeship program like, or do I really just want to get a job in the community now? What types of supports are available? So I mean, it's a very vague answer, I know, but it's so personalized. I would say understanding just enough about public benefits to know that it's better for you to work than not to work, and what that might mean for the trajectory of your life, and knowing what resources are available so you can access them as needed.
Great. And the last question is, if an individual has just $12,000 in Social Security disability for 2018 and has paid no tax, can they qualify for an earned income tax credit?
No. Okay. I don't believe so. So I'm not a tax professional, but if they have not earned any, you will have to have earned wages, in which case you would have paid taxes. And if that's, for the individual who's asking that question, if that didn't answer it, feel free to email me. Oh, actually, you know what? I think we're late enough, right? Yeah, you can go right to my contact slide, Jenny. That way they have that. Feel free to email me or call me.
Any other questions, Nancy?
Nope, that was it.
Okay, well, thank you very much, Andy. Do you have any closing comments?
No, I don't think so. I'd encourage you to look at the links. I wanted to give sort of an overview of what we're doing with Employment First, but that's related to all of the other state-funded employment services as well. So there's information about Access VR, what programs are available through them, about the Office of Mental Health, Office for People with Developmental Disabilities, and also the Department of Labor Career Zone and Job Zone links are there as well, and those are fantastic online career exploration tools. I would encourage you to check those out and have your students or your whoever you're assisting with transition to look at them as well. We also have on our NYESS resource page, our customer resource page, there are short videos about using the different components within Career Zone and Job Zone that I think can be really useful if you're not quite sure what you're going to get out of them or how to navigate it. Those are really useful.
Okay, so I guess that's it for today then, everyone. Thank you for attending. Nancy, we're going to send the PowerPoint, correct?
Correct.
And please do your surveys so that we can get your feedback, and have a great day.
Thank you, everyone.